Welcome back, everyone. If you're unhappy with your body after losing weight, having children, or just plain aging, there are
based on the patient's body shape, the shape of the breast, the diameter of the breast, the chest circumference and hips. We try to give some that's very proportionate, but each of these implants has a specific place in the industry.
Okay, and what did you bring here? What is this, for example?
Well, these are basically silicone implants, and we have a very low profile, a moderate profile, and a high profile type of silicone implant that we have on display today. These are based on the amount of breast tissue that a woman has. And so we do appropriate measurements, and then we determine which of these types of implants would be utilized. We also have a saline implant, which is an implant that we inflate with saline, which is a saltwater solution. And for some women that have a lot of breast tissue, they can accommodate an implant such as this and have a beautiful result. So we just have to look. We also have a saline implant, which is an implant that we inflate with saline, which is a saltwater solution. And for some women that have a lot of breast tissue, they can accommodate an implant such as this and have a beautiful result. So we just have to look at the individual to determine what we're going to use.
How do you decide which type goes with which patient?
It's all based on measurements. It's based on the discussion with the patient in terms of the feel, the look they're trying to achieve. It's based on how much tissue they truly have to cover that implant and hide it and to achieve the look they're looking for.
All right, I don't know a lot about this, but I've heard about people saying, okay, you put the implant above the muscle or below the muscle. Which do you prefer and why?
Well, I'll tell you, most of the time, if we can go below the muscle with the placement of the implant, it's a better way to go because the pectoralis muscle offers support to the implant, and it's a more long-lasting result. Sometimes we do have to go above based on the anatomy of the patient, but for the majority of the patients, we will go below with that placement.
Okay, now let's talk about the candidates and who is a candidate for breast augmentation. We have some before and after photos. They're pretty amazing. Tell me about who can be a candidate and what you did here.
Well, I mean, basically, when we talk about candidates, they range in age from the early 20s all the way through the 50s or 60s. And it's based on the health risks that a patient may have. If they have no health risks, they truly are a candidate. If they have a cosmetic deformity they'd like to correct, if they have one breast that's larger than the other, they have some asymmetry in that effect, we will go ahead and correct those patients. Or if they're just small and would like enlargement or a lift post-pregnancy, those are candidates that would have this procedure done.
And how do you determine the size? I mean, do you work with the women?
Absolutely. I have a very in-depth conversation with them. I try to keep things proportionate so that everything flows, that the breasts are not the main focus, but yet they're voluptuous and they fit the body well. And it's all done on measurements. It's done on discussion, done by discussion with the patient and via thorough evaluation.
All right. Well, we're seeing some of your work now. And before we go, what would you tell someone who is considering a breast augmentation?
They need to do the appropriate research, find the physicians that do the largest volume, that have had the most training in this specific area. They can call the implant corporations such as Mentor or Allergan Corporation. They need to research their doctors thoroughly, understand that they need to be board certified in the area. And then look at a lot of photos, determine exactly the type of work this individual does and see if there's a good relationship there between what you're trying to achieve and what they can do.
All right, a lot of great advice today. Thanks so much for coming on. And to find out more, all you have to do, everyone, is call 623-516-2639 or just go online to bodybykotoske.com. Good to see you. Thanks a lot.
Great to see you, too.
All right, hey, stay with us. More beauty tips coming up on Arizona Midday, including the best way to get a sensational smile and the best beauty products coming